What up? It is Saturday, March 21st, and today is your coronavirus update with your boy, Philly Phil, a.k.a. The Prophet, a.k.a. Long Lost Prince of Lebanon, a.k.a. King of Philippines. Here to hit you with some more info. So today we're going to talk about how our leadership has failed us, okay? I'm sorry, but our leadership has failed us. Starting from the WHO, going to the CDC, starting from China, WHO, CDC, Canada especially, all the way down to all the, basically the hospitals too. I mean, their hands are forced. So they're just following what these guys say. Whatever protocol they put out, they got to follow. We're going to talk about that. I'm going to give you some health tips again today, obviously, because that's an important part. And I'm going to try to make you laugh because these are serious times and, you know, people need to laugh. So I love you guys and let's get right into it. So first, the numbers. So let's take a look at the numbers today, guys. Italy, it's just... they're getting absolutely slaughtered. 793 new cases, 6,500 new infections. It's terrible what's happening there. Spain, Germany coming up, Iran, France, 14,000. This was completely different 2 weeks ago. Look at the UK now with 5,000, coming up with 1,000 new cases today and 56 new deaths. All of these nations, look at us, Canada right there. We had 241 cases today. Today alone, we have 241. Let's take a look at yesterday. So here we have yesterday, Italy, 627. Like, these numbers are absolutely just my heart goes out. They're just getting crushed. Okay, and, when this is all over, somebody's going to have to answer for this because this, to me, was preventable. So let's take a look here. When you click on Canada and you're on that worldometer, you can look at exactly what our statistics are here. So we have 19 total deaths, and as you go down, it tells you the closed cases, and 19 deaths, 58% among the cases that were solved. And as we go down the road here, we can see our graphs. Now, whenever your graph looks like a hockey stick, Canada, that's bad. Okay, we're in the boom stage. I used to say we're in the cluster stage. We are in the boom stage now. Okay, I'm not here to lie to you guys and make you think, it's going to be smooth sailing because, listen, your health ministers lied to you enough. They told you that the risk remains low, and it never was a low risk. If they were prudent, they would have treated this like it was high risk from the beginning. But they had their mind set on people, just not panicking. Look at these numbers. At March 9th, we were at 67. Now we're sitting pretty at 1,300. That's an explosion. It's only been a week and a bit. So, today, I'm really I'm going to focus on these health ministers and how they have led us astray. And you know what? I mean, it's inexcusable what they've done, and they haven't prepared us properly for what's coming. Let's take a look at the clip.
We know the properties of this virus right now, that's how much I'm learning French. Right now, the properties of the virus is that it is spread by droplet. And so what we are trying to do, what the public health system is trying to do, and health professionals are trying to do when they isolate people, is to prevent those droplets from infecting other people. That's the purpose of isolation.
That's not what the data suggested from day one. This clip is from January 30th, okay? And I, as a regular citizen, had already the data that showed that this thing was in aerosolized procedures, meaning that it stayed up in the air up to 4 hours. Now, if I know that, how come the health minister doesn't know that? Continue rolling the clips.
And as of now, there is no evidence that this disease is spread without the symptoms. It's really important to remember that. And I'll say this because, in fact, by spreading misinformation and jumping the gun in terms of how the disease spreads, it's creating quite a bit of fear, especially within the Chinese-Canadian community.
What do you mean there was no evidence? We had the data. We had it. I knew it. How come you didn't know it? They seem to be more concerned with not offending people. See at the end there, she mentioned about fear and misinformation spreading, and that the main concern was not offending Chinese Canadians. I mean, it's not about that. They're more concerned with not offending people and being nice and keeping people in a state of non-fear than actually giving you the information you need. We knew that this spread asymptomatically a long time ago. I can show you articles by doctors in the States. I can show you articles from China that showed the data. How come they didn't know this? This is the reason why we're in the situation we're in. They're going to hate this video. Roll the clips.
Thanks for the question. I think it's important to remind people that the risk is very low in Canada. And that is not necessarily because we're in the clear, but more because of the incredible collaboration and sophisticated systems that we've developed over the last 17 years as a result of our lessons learned through SARS and other infectious diseases that have presented themselves as part of a global epidemic, if you will. In terms of...
So full of themselves. They were so full of themselves. They would get up there all the time and talk about how sophisticated the system is, how it's the best in the world, and we learned our lessons from SARS, and the system is working. And each case that came in, it was just, there's nothing to worry about. We got this on lock. We got this on lock. Continue.
By the WHO of a global emergency. What does that change for us in this country?
Well, actually, Canada has been recognized as having a very sophisticated public health system, and we've been contributing through Dr. Tam's presence on the World Health Organization's committee to the body of evidence and expertise at that level. And so it really doesn't change anything for Canada because, in fact, we're exceeding those recommendations. I think what it calls on, though, is for all of us to work more collaboratively as a world to help support those countries that may not have that same level of sophistication and may not be able to provide the same level of surveillance and control of the spread of the disease.
I know you have been out. You mentioned Dr. Tam, the head of public health in Canada, has been out as well, giving press conferences, trying to say to Canadians, listen, we are at a very low risk here. How concerned should we be?
I think Canadians need to know the risk remains low today. As I said, our surveillance system is working exactly as it should. We've been able to detect any cases that are coming in and treat them appropriately and be able to share information very rapidly with other jurisdictions in Canada that allows for a very rapid response, and the spread of the disease is contained. And so I think the risk remains low. Obviously, there are things people can...
Yeah, real experts, real expertise. That's really good. Exceeding expectations. You hear that part? We're exceeding expectations of the WHO. The surveillance system is working. It's contained. Look, if they really wanted to put a lid on this, then back at January 30th, they should have stopped all travel. They should have quarantined people. They should have recognized and quarantined the asymptomatic cases. And they should have ordered enough masks. How can you sit there and talk about how ready we are and not order enough masks? We don't have the PPE. We don't have the masks. We're going to get to that in a bit. We're almost done with the clips, okay?
Of health. So that's been very helpful to understand where people are at in terms of their preparedness. I will remind Canadians that the American system is very different than ours, and we do have a pandemic plan, and we have been working provincially and territorially with our partners across the country since Dr. Tam noticed, in fact, in late December, the cluster of infection that was happening in Wuhan. And so we have an advantage of having that pandemic planning well in advance. We also don't need to call it a public health emergency in order to trigger all of those systems and structures to come into place. And we also have a robust system of testing, as you know, both at provincial level, but also the federal lab that's able to provide testing results very quickly and confirm testing at the provincial level. So we're in a different situation than the United States from an organizational perspective. But
Premier Doug Ford is urging any businesses in Ontario to shift their manufacturing and begin creating life-saving medical supplies that are dwindling in this province.
Our frontline healthcare workers are running out of key items. We need ventilators, face masks, surgical gowns, protective eyewear, hand sanitizer, disinfecting wipes, swabs, medical gloves, and lab testing equipment. My message to business owners in Ontario is this: if you can retool your business to make these products, if you can supply these essential items, we need to hear from you right now.
Prepared. We have emergency pandemic preparations. This was February 25th, okay? This was like 3 weeks ago. They're talking about how they had pandemic stuff prepared. They were all ready to go, okay? And the system was working great, and they have a robust system and aggressive everything. And we're not like the States. The States it's a very different system. We're very organized here. Yet today, Ford, the premier, got up and begged businesses that we need to start making masks. They never ordered masks. They came out, red line today, headline: we don't have enough medical equipment. Who's going to answer for this stuff? They made a statement 3 weeks ago saying that they were ready. And now we find out that they're not ready. It's because they're not transparent with people from the beginning. Okay? These guys are total politicians. Okay? Just total politicians. These people, someone's got to answer for this.
No. The situation at home, according to health officials in this country, the risk remains low still, even though the number of Canadian cases continues to climb. We are now talking about 67 presumed and confirmed cases, and there are cases that are presumptive in Alberta and Quebec, including another possible infection in the Greater Toronto area that we're hearing of.
Did you see that? Did you see that? On March 9th, last week, March 9th, okay? They said the risk remains low. Still, they're still holding on to that line. They're so concerned with making you think that the risk is low. And then all of a sudden now we go like this. Case, cluster, boom! 67 cases on March 9th. The short-sightedness of these guys. I saw this so long ago. Everybody who knows me knows I talked about it. And it was all over the place. How could you guys not learn from what was happening in Italy? 67 cases on March 9th, and the risk remained low. And now, 67 cases, now we have 1,325. It's not even 2 weeks later. People, our leaders have failed us, okay? Completely failed us. I thought it was contained. I thought we had this on lock, you know? It was all good. And even if it's not good, we have all of our pandemic supplies ready to go. Meanwhile, I'm hearing stories of nurses that are being told that they can't wear the N95 mask, that we don't have enough. We don't have enough. Now, they have to walk in and repeat the same thing as SARS, which we're going to talk about in a minute, which is where nurses are going in and they're going to end up contracting the disease, and we're sending them like lambs to the slaughter because of bad leadership. But they should not have to be the ones who put themselves on the line, their lives and their families' lives and well-being, because this leadership completely failed. It's absolutely unacceptable. Okay, folks, well, now it's time to bring on the tears because, you know, we never saw this coming, and it's important to help people. And my God, you should have planned properly.
With care and respect. This pandemic is no exception. We will get through this hard time together. So my last appeal is make sure that you're kind to one another. Check in with vulnerable people by phone. Think of ways you can help to ensure that we get through this together. There are scared people. There are lonely people. There are frightened people. And it doesn't take a lot to reach out to them and say that you're there with them, even in spirit, to ask what they might need.
Part of the massive failure of our leadership was the appropriate ordering and stocking up of PPE items, protective equipment, and in particular the masks, N95 mask. So we're going to look at a couple articles right here and see what we actually did learn from SARS, if we learned anything at all, which we didn't. Just repeating the same thing. People don't know that half of the people who got SARS in Toronto were nurses. And if we read here, it says a study, 8 of the 32 nurses who entered a SARS patient's room were infected. The probability of a SARS infection was 6% per shift worked. So if we go down there, it says consistently wearing either a surgical or particulate respiratory type N95 while caring for a SARS patient was protective for the nurses, and consistent with the use of the N95 mask was more protective than the regular mask. Let's go up here, okay? Because I don't got all night. I have to make it quick. Let's go right into the government's website. I'll put all of these in the description. This is straight from the government's website, and it's the findings and the quote-unquote lessons that were learned by the commission from SARS. So this is from the government's website. This is supposed to be the lessons that they learned. Now if we go down, this is a key part. Okay? So it says right here, if you look at the bottom, if the commission has one single take-home message, it is the precautionary principle that safety comes first, that reasonable efforts to reduce risk need not await scientific proof. Ontario needs to enshrine this principle and enforce it throughout the entire health system. Okay? That means that if somebody thinks it's airborne and you're saying that it's just droplets, and we want to be overcautious. And that says right there that that's their take-home message. It needs not science to prove that. And we are sending our nurses in there as lambs to the slaughter, not prepared. Just read this. Read this. Page 13, page 14. The main thing here, it says if the commission has one single take-home message. They were supposed to take that home. Well, if you want to know what is in my shopping bags, I just took a little trip. This is not my first trip, but, you know, I thought I'd just share this with you guys. First of all, you can't find the chemical grade medical goggles anywhere, so my next best suggestion to you would be to get yourself some regular goggles, like swimming goggles, because I mean, if it keeps water out, it's got to be pretty good, right? So hey, better than nothing. Now when it comes to this type of stuff, everybody gets canned food that's usually, you know, beans and soup, whatever, what have you, but you guys got to remember, stay up on the vegetables. Okay, make sure you get vegetables. These are cut green beans, all right, asparagus. If anything ever happens, God forbid, you want to make sure you got vegetables, because that's where you get all your vitamins from. So carrots, right? Beets, right? Beets, carrots, asparagus. I mean, that's top notch right there. Of course, you got your, you know, your beans, whatever. I got a bunch of, where is that soup? Yeah, I got some soup right here. I like to get these. Vegetable broth, because you still get the vegetables in the broth. And then of course I got a beef broth one too. In terms of meats, it's not too late. You can still go out there and go get your meats. You know, we got lamb. I always like to get like a bunch of these value pack, throw them in the freezer. You know, again, asparagus, chicken breast. And yeah, that's it, man. So I really hope you guys are going out there and getting your food. I mean, we all know that the food's not going to run out. It will continue, but you don't want a chance having to leave your house in a total lockdown. You don't want to have to go and be in line for 10 hours or wait outside or just be near the virus, you know? So those will become hotspots for transmission. All right? So that's it, folks. That's the episode for today. And, you know, I'm a free citizen, and I have a right to voice my opinion on our leadership, which I do believe has failed us, and I think a lot of people would agree. And so, yeah, the big health tips for today basically is get yourself a pair of goggles, because you can't buy them anywhere now. No more chemicals left. And every time I go to Canadian Tire, they tell me that they don't have any, yet there's 30 in the system. Could they be keeping it for themselves? I don't know. I don't want to get too crazy, but it's very strange. Can't find masks anywhere. Probably should have stocked up from before, but hopefully if those businesses come around, they'll start putting into production. I'm really jealous of Taiwan. I mean, they handled this thing amazing. I might just, I don't know, I might have to visit Taiwan after all this is over. And I just want to say, you know, Patty Hadjdu, if you ever do end up watching this or this catches wind, look, I don't hate you, okay? We're all human, we all make mistakes, but you and Dr. Theresa Tam, you guys dropped the ball on this one. And I think that when it's all said and done, people are going to want answers. And I think you guys need to come out now and apologize for what's happened here. Because if I, as a regular citizen, have known all of this stuff, and you guys didn't, then somebody wasn't informing you correctly, and you didn't have a handle on the situation. This is my comments as a free citizen, okay? So, that's it. How you like them apples? See y'all on Monday.